Well, hey there, future nurses. Welcome back to Med Monday. Let's go ahead and jump in and get started. So, this week's medication is midazolam, and the trade name is Versed. The functional class is a sedative, it's a hypnotic, and it's an anti anxiety medication. And I should have put in here that it's an amnesiac. The chemical class is benzodiazepine. And this medication can be given orally, IV through a push or a drip, and intramuscularly. It works by increasing the activity of the GABA neurotransmitter in the brain. And this is an important fact to know. The elimination half-life is about 1.5 to 2.5 hours, which is why this is utilized in outpatient procedures because it's a relatively quick recovery. The indication is for preoperative sedation, anesthesia induction, intubation, anxiety, refractory status epilepticus, alcohol withdrawal, agitation, and it's contraindicated in pregnancy, acute closed angle glaucoma, head injuries, and hypotension. Now, we can use this precautiously in patients with renal and hepatic dysfunction because of the metabolism. We can also use this precautiously in geriatric patients and in pediatric patients. Side effects, remember, are non-life-threatening, and those include amnesia, confusion, especially for our older patients, weakness, paradoxical reactions, meaning rather than have a sedatory effect, it will actually cause increased agitation, alertness. Basically, it has the opposite effect that it should. And hypotension, blurred vision. Adverse reactions, remember, these are life-threatening, and those include cardiac arrest. And I have seen this happen working in PECU in the OR when they push the Versed to induce sedation, getting ready for intubation. We've had patients code on the OR table. Apnea, bronchospasm, respiratory depression, and anaphylaxis. So, nursing considerations. This medication does have a black box warning, and that is because it causes respiratory depression and apnea. So, if your patient is receiving this medication, you need to be aware of that and monitor that. So, if we are administering this medication or we have received a patient post-operatively or post-procedure that has received this medication, we're going to monitor the blood pressure, our respiratory rate, pattern, and effort. We're also going to monitor our heart rate, and especially during administration, we're going to monitor these. We want to make sure that we have emergency equipment nearby, meaning we have our bag mask valves, we have oxygen ready, we have suction ready in case they vomit, we have our monitors nearby. I just had a senior moment, I guess. We have our monitors nearby so that we can monitor our heart rate. Usually, if we're doing a procedure in the room, we put the crash cart so that in the event the patient goes into an arrhythmia, we already have them hooked up to the monitor and we can cardiovert if we need to. You also want to make sure that you have the reversal available if you are administering this medication, and that is flumazenil. This medication may cause amnesia in geriatric patients. It may cause acute confusion in geriatric patients as well. The half-life may be increased in obese patients. And we want to make sure that we assist with ambulation because they can get dizzy, they can have issues ambulating, especially with our older patients. Patient teaching, there's really not a lot that we're going to teach this patient. there's really no labs or anything, but we do want to teach them about the medication, why we're using it, the action that the medication has, and any potential side effects that they may experience. We also want to make sure that they know to call for assistance when ambulating, that it may cause a little amnesia that they may forget. And especially when this medication is used in procedural sedation, we call it conscious sedation because they're not really asleep. We use it a lot in endoscopic procedures, and especially like for colonoscopies, they're asleep. Well, no, I take that back. They're awake, but they think they're asleep and they don't remember the procedure. And we want to let them know that the vital signs will be monitored frequently. So that's it for this week's Med Monday. I hope that you guys are enjoying this series. If you haven't already subscribed, make sure that you go to NursingSchoolSimplified.com/Med Monday, and I will send you the videos and the Med Fact Sheet every week. So until next week, have a great week and keep working on your dream.